The vagus nerve is one of the most remarkable structures in the human body, a vast neural superhighway linking the gut to the brain with speed, precision, and purpose. Though it has been known for centuries as the 10th cranial nerve, its full physiological significance is only now being fully appreciated. Far from simply controlling heart rate or gut motility, the vagus nerve is increasingly understood as a real-time communication axis, transmitting sensory data from the internal organs to the brain in milliseconds and coordinating emotional, metabolic, and immune responses in return. This rapid, bidirectional traffic makes it a cornerstone of how we regulate hunger, emotion, inflammation, and even resilience to disease. What sets the vagus nerve apart is not just its reach. It touches nearly every major organ in the torso, but its sensory dominance. About 80% of the vagus nerve's fibers are afferent, meaning they carry information from the body to the brain. This afferent flow includes mechanical signals like stomach stretch, but more importantly, it transmits chemical and microbial information from the gut environment to the brainstem. Specialized gut cells like neuropods and enteroendocrine cells are equipped to sense nutrients, hormones, and microbial metabolites, and they synapse directly onto vagal fibers to deliver updates in real time. This allows the brain to perceive the internal state of the digestive system and, by extension, the microbial ecosystem, with a level of immediacy comparable to our external senses. One of the most powerful examples of this communication is the way the vagus nerve regulates hunger and satiety. When food enters the stomach and small intestine, stretch receptors and nutrient sensors send signals via the vagus to the nucleus tractus solitarius, NTS, in the brainstem, which then integrates this information with hormonal data from ghrelin, leptin, GLP-1, and PYY. The result is a finely calibrated sense of when we've had enough to eat. But this is not a one-way process. The brain also sends efferent signals back through the vagus nerve to adjust gut motility, enzyme secretion, and even immune tone. This loop happens in fractions of a second, providing the agility needed to match appetite with real-time digestive status. The role of the vagus nerve in emotional regulation is equally profound. Its signals influence key brain regions involved in stress, anxiety, and mood, including the amygdala, hypothalamus, and prefrontal cortex. Through these pathways, the gut can talk to the emotional centers of the brain, shaping our experience of safety, calm, and threat. When the gut is healthy and microbial signaling is balanced, vagal tone tends to be high, a state associated with better emotional stability, lower cortisol, and greater capacity for social engagement. In contrast, a disrupted gut or low vagal tone correlates with heightened anxiety, mood swings, and a reduced ability to recover from stress. This makes the vagus nerve a biological substrate for what's often referred to as the gut-brain axis, a dynamic interface where digestion and emotion converge. Perhaps even more striking is the vagus nerve's influence on inflammation and immunity. It forms the backbone of the cholinergic anti-inflammatory reflex, a mechanism by which the brain can detect and dampen systemic inflammation. When immune cells in the gut detect pathogens or microbial imbalance, they relay signals that reach the brain via vagal afferents. In response, the brain can send inhibitory signals back through vagal efferents to reduce the production of pro-inflammatory cytokines like TNF-alpha. This feedback loop helps keep inflammation in check, preventing unnecessary immune activation that could lead to chronic diseases like rheumatoid arthritis, inflammatory bowel disease, or even depression. In fact, low vagal tone is now considered a risk factor for a range of chronic inflammatory and neuropsychiatric disorders. The speed of vagal signaling is one of its most overlooked but crucial features. Unlike hormonal feedback, which takes minutes to hours, vagal signals travel at lightning speed, milliseconds in some cases, allowing for nearly instantaneous updates between the gut and the brain. This makes the vagus nerve especially suited for coordinating responses to food intake, microbial changes, emotional stress, and physical exertion. It's not just a regulator, it's a real-time mediator of adaptation. Emerging therapies are beginning to leverage this superhighway for clinical benefit. Vagus nerve stimulation, VNS, originally developed for epilepsy, is now being explored for depression, obesity, PTSD, and inflammatory conditions. By electrically activating the nerve, clinicians can nudge the system back toward balance, reducing inflammation, improving mood, and even enhancing metabolic control. Non-invasive methods such as transcutaneous auricular stimulation offer a gentler way to harness this pathway, potentially offering new hope for patients with hard-to-treat chronic conditions. But perhaps the most exciting implication of the vagus nerve's role in gut-brain communication is its relevance to everyday lifestyle choices. Practices that improve vagal tone, such as deep breathing, cold exposure, meditation, singing, and regular exercise, may help reinforce the gut-brain connection and build resilience. Diet, too, plays a key role. Fermented foods, fiber-rich meals, and polyphenol-rich plants all support a healthy gut microbiome, which in turn sends more favorable signals to the brain. In this sense, how we eat, breathe, and move shapes the very dialogue between our organs and our mind. In conclusion, the vagus nerve is not just a passive conduit, but an active intelligence system, orchestrating moment-by-moment adjustments in hunger, emotion, immunity, and inflammation. It serves as a high-speed neural link between our microbial self and our conscious experience, allowing the body to stay in sync with its internal ecosystem. Understanding and supporting this system may be one of the most effective paths toward holistic health, physical, emotional, and cognitive alike. As we continue to decode this superhighway, the age-old wisdom that gut feelings matter is gaining the full force of scientific validation.